Welcome back, class. We're going to finish this up just probably pretty quickly with this third component, but I want to talk for a few minutes about, is business ethics necessary? And as a follow on to that, or the transition of that, is healthcare ethics necessary? So again, if you look, if you've been listen to the videos, kind of follow along, theoretically my train of thought. That's assuming I do have a train of thought. Sometimes I actually wonder myself, but if you're following my train of thought, trying to show that healthcare is just a subset of business ethics. Healthcare ethics, a subset of business ethics, maybe a little more in depth, or maybe a little more detailed or impactful than some of the ethics and morality issues that you might run into at Starbucks or Target or Walmart or wherever you are. But when we talk about business ethics, one of the things the textbook talks about, does the mean justify the end versus the end justifying the means? And when the text talks about means, it's what you do in order to reach a goal, and the ends, the goals you want to reach. So you've got goals, which are the end, and how you're going to get there. So again, I go back to the meetings we always had in December, where it was in rah, here's what we're going to do next year, and then here's the goals. Everybody rolls out the goals, and you get your goal. And I'm sitting there thinking, and a lot of the individuals in the room thinking, man, they're going to increase our goals by X%. It was all we could do to make it this year. How are we going to do it next year? And so you are almost, sometimes you are put in a situation, especially if you're a sales, especially if you're a member of the sales team, you're put in a situation, or if you're part of actuary, or when I worked at Blue Cross Blue Shield, I directed the payment integrity team. And again, I'll get into that in one of the later modules, but had a financial goal. And the CFO didn't, the CFO had a linear thought process. So if my team recovered $100 million in overpaid claims this year, he expected us to increase that by 20% the next year. So 100 million in 2023, I was expected to bring in 120 million in 2024. I mean, that was just that linear process he went through. It's kind of like McDonald's. You're talking about advertising, and you're talking about driving sales, or if you're the sales team at a health plan, you're talking about it. If your membership is 600,000 this year, how are you going to get that to like 660,000, in 2024? So that's what we're talking about when we're talking about means and ends. And one of I guess the two extreme views in the business world, and I think it applies to healthcare to some extent anyway. The first one is business needs policing because it's a dirty enterprise featuring people who get ahead by being selfish liars. Again, goes back to the economics, the self-interest, the optimization. So one theory, or one thought process, or one body of theory, let's say, is that everybody in business are crooks. Everybody in business are liars. They get ahead by being crooked, and they get ahead by lying. Now, the second view of that is going to be successful businesses work well to enrich society, and business ethics are interfering with annoying scolds threatening to run our economic welfare. So basically, the first one says you got to have business ethics or healthcare ethics in this, in this class, but you've got to have business ethics to ensure that this bunch of crooks, and I'm not sure in healthcare where they're talking about employer groups and employees, the health plan, or the providers, or even public policy setting over here. But you've got to have ethics to ensure that the crooks and the liars don't take advantage of everybody. The second one says you don't need business ethics, period, because all it does is it is a drag, it is a dead weight on society, or at least on the free market or the capitalistic market, that's going to perform in a way that's going to better society. You know, it kind of like if you believe in the first one, if you're in business, then you're a liar anyway. And I think that's one of the articles they talk about in the text of Harvard Business School. They're talking about that. And, you know, bluffing works in business, and information drives the most successful business decisions. Not everyone in business is a liar, but they may stretch the truth. Okay. Let's go back to the bluffing part. When I worked at HealthNet in the early to mid 90s, I was in charge of developing a provider network in Southern California. Huge provider network. And part of that, developing that provider network, was the contracting process. I'm contracting with medical groups, individual providers. I'm contracting with hospitals, not just myself, but I had a team helping me contract. And in the process of contracting, in the process of negotiating contracts, we may have, to some extent, bluffed. We may, to some extent, have stretched the truth, but I looked at it more in terms of I just had access to better information. I understood the information, because in any negotiation process, there are parameters set. So in any negotiation process, the buyer has a number. So the buyer sets the top of that range, the negotiating range, because they have a value that they're not going to go above. The seller going to set the bottom end of that negotiating range because they have a value that they're just not going to go below. And it's the ability of those individuals in that negotiation process to get closest to where they need to be. So I know that I'm setting the top, seller setting the bottom. I want to be as close to the seller's number as I can. The seller wants to be as close to my number as they can. So that's where the negotiation range. And with me, it was based on information. An economist, financial guy, understood healthcare information. I could take information and use it to my benefit to negotiate the most cost-effective rate for the health plan. And those cost-effective rates we could pass on to the members and provide access to affordable health care. Now, when you talk about stretching the truth, now we're talking about, to some extent, kind of this, agent principal issue. So patients walk into a doctor's office, and, if you're like me, you go into the doctor's office, and you go to the doctor's office for one of two reasons. I go because I have to get my annual physical done, or I go because I'm not feeling well. And it irritates me to no end to walk into a doctor's office and, doctor says, well, how are you feeling? Why are you here today? Well, I'm here today because I don't feel well. Don't be such an idiot, but I'm here because I don't feel well. I need somebody to diagnose what I have and somebody to provide me a regimen of healthcare that's going to make me feel better. And what happens in the principal agent situation is the patient's the principal, provider's the agent. the principal, and a lot of individuals are guilty of this. The principal does not provide, maybe is not forthcoming with all of the information. The provider, as the agent, has gone to medical school, and they should be well versed. They should have more knowledge than the patient on diagnosing their issues and providing a treatment regime for them. But the way this agent principal dynamic works is you're starting to stretch the truth and maybe not as forthcoming. So the doctor says, or maybe a lot of time, not now, it's not even the doctor that talks to you, it's some kind of a technical person that's going through and says, what medications are you taking? Do you consume drugs? Do you smoke? Do you dip snuff? Do you chew? Do you consume alcohol? Have you been depressed? I mean, they're asking you all of these questions, and a lot of times patients won't necessarily be forthcoming. So that's going to skew the information the provider has. The provider sitting over here, and we'll get into some of this in the next module, but the provider sitting over here has access to this wealth of information. Gone to medical school, hopefully you've done an internship and a residency, and they know what they're doing. And so they have access to this information. And the provider's, sitting there looking at the patient and saying, he's thinking, this patient, I'm not exactly sure what's the issue, but I'll bet you if I prescribe some lab tests, I can get some information that's going to help me. And oh, by the way, I just have this brand new, laboratory set up in my office, and I can get some of the work done here, and I can charge the insurance company back for some of the work. So, the providers running through the provider's head, there's questions and different processes running through the patient's head. And so we end up with this agent principal issue. And that's one of the reasons that, healthcare to some extent is out of whack. And then lastly, they talk about, if you believe the first one, that, then healthcare is just corrupt and it needs serious ethical policing. And healthcare is somewhat corrupt. It'll be in one of the follow-on modules, but I think in 2022, the healthcare expenditures, I want to say, was $4.1 trillion. And of that $4.1 trillion, 25% of that was due to waste and abuse. Services, redundant services ordered that weren't used, services ordered that, didn't have any relationship to the treatment protocol. But you think about that. If it was, again, the numbers may be off a little, we'll get into it later, but I think it was like 4.1 trillion, 25% of that's like, a little over $1 trillion. That's a lot of money just for waste and abuse. If you believe in the second one now, economic enterprises provide wealth for our society while correcting issues internally. That, from an economic perspective, and I believe in the capital market. I believe in a free-flowing, capitalistic market. I believe in supply and demand, and to some extent that holds true. Healthcare is no different, again, from your local restaurant. You go in your local restaurant, and you've been there, going there for years, and you've always had great meals, fair price. And now all of a sudden, with inflation, out of control, and the prices just keep bumping up, and so you're starting to see a kind of a deterioration in the service you get, because wait staff isn't as good as they used to be, and maybe the chef, they've had to drop down a lower run to get a chef, and the food may not be as great as it used to be. And so you start getting these negative vibes, and you start looking at the supply demand dynamics. You think, well, I still want to go out to eat, and there's a lot more restaurants in this one. I've always liked this one, but I may give it a second chance, and you go back and give it a second chance, and it's just as bad as the experience you had last time. That's probably the last time you go. And so if you believe in the second, that it's that you know ethical policing is not required, that the capitalistic market's going to take care of it, and supply and demand is going to drive everything, then the marketplace uh, understands, in ethical terms, it's the enforcement of rules for behavior by the economic reality. So market's going to take care of itself. I can't remember which econ class in graduate school I had to read it, but had to read Adam Smith's Wealth of Nations. And Adam Smith, the Scottish economist, and his theory was the market is going to take supply and demand, and the market will go to equilibrium. His comment was the invisible hand. There was an invisible hand, according to Adam Smith, that would drive the market to equilibrium, and supply and demand would make all those adjustments. And that's what we're talking about in this second approach: is market's going to take care of itself. Supply and demand, bad reviews, bad pricing, negative outcomes. And it's one thing to go into a restaurant and have a bad meal and decide not to go back. It's an entirely different situation if you are sick and you go to the doctor's office and you have a less than competent healthcare provider that develops and puts you on a treatment protocol that actually makes things go south. That's a whole different ball game. So to me it's a little more difficult in the healthcare environment to let the capital market take care of itself. Easier on a restaurant, Starbucks. I mean, heck, if it gets the, I don't know, I don't drink coffee, but I hear people complaining about the prices of Starbucks. So maybe that, macchiato, you woo-woo drink that you get in Starbucks now is like $8 to $10 or something. I don't know. But price and service and quality of food is it's going to take care of itself in the capital market. But you got to be really careful about healthcare, because the last thing you want is an incompetent provider that develops and puts you on a treatment protocol that goes south. That is just not something you want. And again, in healthcare, it's not as transparent as it should be. It's not customer centric like it should be. If I walk into downtown Atlanta and stand on a street corner and I ask the first 100 people that walk by, and I say, what is it going to cost for, let me think, what does a gallon of milk cost? What does a gallon of milk cost the last time you bought it? And they have a pretty good idea what that gallon of milk costs. If I ask 100 people on that same street corner, what did it cost you? Or if I ask them, what was the cost of your last doctor's visit? They don't really know. They may say, well, it cost me $5 because that's my copay. Or they may have said, well, it cost me, my co-insurance, and it was like $20. Or I said, I'm on a deductible plan. I'm on a high deductible plan, and it cost me this many dollars. Now, if you're on a high deductible plan, you probably have a better idea of what it's going to cost than that individual that's on co-insurance or copay. But where I'm going with this is healthcare is not as transparent as other market economies. It's not as customer centric as other market economies. So a lot of individuals don't really understand the cost of healthcare. They get their explanation of benefits, their EOB. Most of them, I was going to say in the mail, but most of them are on the internet now, so you get out on on the website and get it. But they're looking at bill charge, and they're looking at allowed amount, what your liability is, and it gets really confusing in a hurry. But um, it's healthcare's got to become more customer centric and got to become more transparent if we're ever going to take and bend that healthcare trend. And that's what it talks about, kind of winding this up in the text. Is it says, if this works, then another layer of academic ethics isn't necessary. So basically it's saying consumer demand forces customers into a reputable behavior. Consumer demand forces those providers of goods and services into a reputable behavior. And if that works through market factors, through supply and demand, then you don't need a bunch of academic ethics. You don't need a bunch of academicians telling everybody, well, here's what morality is and here's what ethical decisions are. The market's going to take care of itself. My argument is going to always be, it's not I'm looking at, on one end of the distribution, I'm looking at, you got to police it because it's a bunch of crooks and liars. I'm looking at the other end and say, well, it's a market economy and supply and demand is going to take care of it. I think it's somewhere in between. And because it's somewhere in between, business ethics and healthcare ethics are just inevitable. They're at some level, they're going to be there. Whether it's the feds, whether it's state, whether it's local governments, whether it's credentialing authorities, or it may be just the CEO develops a corporate culture that's going to drive ethics and morality. It's going to be available at some level. And with that, we're going to wind this up. And I think the next module that we're going to touch base on may be talking about some specifics of healthcare equity. Thanks for joining, and talk to you soon.